In Ontario, some people can now buy faster access to health appointments with nurse practitioners. It costs $30 a month, and it's legal under both the federal and provincial Medicare rules. But it's raising concerns about two-tier healthcare. The CBC's Mike Crawley has more on what this new paid service can offer and why it's controversial.
Well, Hillary, it works with nurse practitioners who are able to do a lot of the things that family doctors do. They can diagnose illnesses, they can prescribe medications, they can order tests. And so some family doctors, we've learned of a few, are offering this optional extra of getting rapid access to nurse practitioners. We spoke with a clinic called KinderCare. It's a pediatric clinic in Toronto, and they explain their option as you pay $29 a month for, if you have one child, $59 a month for two or more children. And what that gives you is immediate access to a virtual appointment with the nurse practitioner, basically on the spot. And if necessary, you can get an in-person appointment with a nurse practitioner, like the one that you see in the pictures here, within the next day. And so I spoke with a pediatrician who came up with this plan, and they started it at this clinic last fall when doctors were overwhelmed with demand from patients during that surge in respiratory illnesses last fall, and they had so many patients wanting to see them that they had to turn patients away. Here's Dr. Dan Flanders.
There was real distress that we can't provide the service that these patients need. So towards the end of the year, I came up with this concept of bringing on nurse practitioners, having their salaries paid by a monthly subscription fee that patients pay to have access. And this has opened up a door so that more young families can have access to healthcare.
Now, Dr. Flanders said that it is not ideal that patients have to pay to see these nurse practitioners, but he wishes that it were publicly funded.
And Mike, what are the critics saying about all of this?
Well, so critics are saying that this, although it is perfectly legal, that it is a form of two-tier healthcare because people who can pay get faster access to healthcare, to service. But the acknowledgement is that, yeah, it's perfectly legal. Under the Canada Health Act, doctors are not supposed to be allowed to charge for what's called a medically necessary service that is insured by provincial health plans. And that's where the catch comes in. Nurse practitioner services are not insured by Ontario's OHIP program, the Ontario Health Insurance Plan. There's a little twist to this as well, Hillary, that in some cases, nurse practitioner services actually are funded by the province of Ontario. That's if you're seeing what's called a family health team. So there are some nurse practitioners that work as part of that, and the doctors who are in a family health team get funding for those nurse practitioners. So you see there's this fundamental disparity here in the system. I spoke with Dr. Danielle Martin. She is the chair of the Department of Family and Community Medicine at the University of Toronto, and here's what she had to say.
If we want to give access to high-quality services to the full population in the community, close to home, for everybody in an equitable way, then the answer has got to be teams. And the teams have to be covered by public funds, and they have to be covered for everyone.
Now, I asked Ontario's health minister about this yesterday, and she said she needed more information before she'd be able to comment.
CBC's Mike Crawley for us in Toronto.